Gentlemen, yeah, yeah. Half an hour later, oh, I didn't get it. But very often the pelvis can be a big deal. And I can examine you, and in 5 minutes I'll tell you, hey, is this something you should consider? Okay, hi, welcome.
Hi,
welcome.
Sorry about being
no
late.
problem, it's traffic, you know, this is Sarasota, you know, have a seat.
Ambulance.
Yeah,
Sarasota.
have a seat, yeah. Is there any particular area that you're interested in, sir?
My knee.
Your knee, okay. We have a special on knees this month.
Wow. Give me a new one. That's what
We
I
will
wanna
need
avoid.
some copies of the monthly schedule, like for the stem cell.
They're
Oh, they're there.
behind.
Okay,
I
but we
can
need
flip them
to
up.
give them to people.
Sure.
It's okay. It's okay. It's okay. We'll just give it to them.
All
As
right.
So, hi, I'm Dr. Walter. Welcome. And my videographer here says, don't forget to say about your website. You know, regenortho.com. Did you go on the website at all?
No, I
Didn't get a chance yet. Okay. But, you know, it's just a good place to get additional information and more specific information. And we give seminars about once or twice a month at least.
Good.
Okay. Well, just to kind of educate
I
people.
wasn't able to bring my wife. She had something else going.
Oh, okay. Okay, no problem. Yeah. So we were talking about back pain. And you don't mind my videographer taking some pictures. You guys are just in the background. We won't use names, okay? But we were talking about back pain. Was this an accident-related thing? From lifting something or a car accident? Or
More of actually a fall.
a fall, okay. Okay. So the pelvis might be a big deal. So because you visited today, we offer you a free consultation. You can come, I can examine you, and I can tell you immediately if you're a candidate for this type of treatment, okay? Very important, because I may be the only guy, or one of the only guys in Florida who will tell you this, right? And this gentleman, I mean, you know, like I said, you had surgery, the surgeons did what they could, but you still got a problem. And we got to diagnose it. So every, you know, good medicine starts from the correct diagnosis. Okay. What's causing the problem? What structure is causing the problem? Whether it's the back or whether it's the knee, it's the same thing. I was explaining a little earlier for the knee, it isn't just that the cartilage is worn out and, you know, you're bone on bone. It's that you have instability of the joint. Okay, the joint is moving more than it should. And a major source of pain is where the nerve endings attach to the ligaments that hold things together. When you pull on it, that causes a lot of pain. Okay, so the pain isn't this, it's this in many cases. Okay, and our goal with stem cells is to make the joint stronger, more stable, and of course to solve the pain problem, right? And of course, our goal is to help you avoid knee replacement, you know, because orthopedic surgeons, all roads end in knee replacement, right? So that's our goal, is to offer you an alternative.
Good.
Stem cells is structural. This is not pain management, okay? If you come to see me and I examine your back and I say, yes, I can help you, we're looking for a structural healing. Okay, we're fixing the structure. It's not pain management. Okay, pain, I mean, you know, people do steroid shot and you feel better for a month or something. Okay, that's not what we're talking here. Same for knee. It isn't just like a steroid shot that you might feel better for a month. We're trying to repair the structure and get to the root cause of what caused the pain to start with. Okay, and I'm happy to see the MRIs and so on, but most important is I need to examine the joint and check the various structures in the joint to find where the pain actually is coming from. Which knee is it that hurts you?
That's the right one.
Okay, can I just have a look at it? Do you mind? Just bend the knee for me, please. Yeah. Okay. So I'm just going to look for any tender here, discomfort.
Little,
Yeah,
yes,
yeah.
little, yes,
Tender here.
yes,
Yeah. Okay. Tender here.
yes.
Yeah, okay. So I'm looking for the jump sign. Okay, I'm testing the various structures of the knee to prioritize what structure is the big problem here. Okay, because when we take your stem cells, and by the way the stem cell procedure works is you come in, it's all done in, it takes about a little less than 4 hours. You come in, we put a little cannula under the skin. We only use DNA matched stem cells, okay, from your own fat, okay? And we add the growth factors from your blood, and we put them together, and we'll inject them immediately. So to have a great result, you need to use the right kind of stem cells, which is from fat, are by far the best. You need to add the growth factors from your blood, and you need to put them in the right spot. So you need a doctor who can prioritize the structures and put the stem cells exactly where they need to go. So everything is a diagnostic thing. If you come to see me, I'm going to examine your back, and I'm going to say, okay, these are the structures that are a problem, okay? And, you know, I'm looking for the jump sign, okay? Okay, and if I find the jump sign, I'm going to tell you, okay, this is the problem. And I don't really care what the MRI shows, okay? I'm going to go by my exam so I can prioritize the structures and, you know, find what the issue is, right? Generally speaking, we're going to have about an 85% success rate, okay? If I find what I'm looking for, okay, and confirm that you're a good candidate, we're generally going to have about an 85% success rate, okay?
By that you mean pain-free?
I'm going to say 80% that you're going to have 80% improvement.
Okay.
This is not magic, okay? But this is good medicine, okay? Now, let's say we do a stem cell. These are can I have the calendars?
Yeah.
Just give one to that family. And no, it's okay. Not everybody needs it. No,
Okay,
just
not
one.
everybody.
No. That's a family.
Okay.
You- I just give this to you. These are the dates, for example, that we do the stem cell procedures, okay? And let's say you come and you have a stem cell procedure, okay? And let's say once you do a stem cell procedure with us, we continue to follow you to make sure you know, have good rehab and so on, okay? That you're rehabbing correctly and so on, okay?
When you say rehab, are you talking like physical therapy?
No, I'm not going to send you physical therapy. You're going to do your own
Rehab.
therapy, okay? So the great thing about stem cells is once we do the stem cell, you know, you're basically going to return to activities of daily living like the next day. You're going to be walking and talking. No, I'm okay. Right, you're going to return to activities of daily living. So there's really no downtime. You're going to be a little sore for a couple days where we took the fat. And the joint's going to be a little sore for an hour or two where we injected you. And that's about it, you know. So that's the great part. And we're only using your own DNA matched stem cells. So, you know, that kind of, you know, the risk is you're going to pay your money and it's not going to work like you hope it will. And that brings us to the point, well, how much does it cost, doctor? Okay. So a stem cell like for a knee is $7,000, okay, all in, okay. And let's say you came and we did a stem cell and we can, you know, you see Boris, you get orthotics, you're walking good, and you come back 6 weeks later and you say, well, it's only about 60% better, you know, I was hoping to play pickleball, you know. Then we may decide to do a PRP booster because the stem cells remain alive for at least 4 or 5 months. Hi.
Hi.
Welcome.
Sorry.
I know, it's Sarasota. You never know.
stuck on the bridge.
Yeah, you never know. Okay, it's Sarasota, you know.
We didn't think it was going to be that.
Yeah. So you may decide to do a PRP booster because the stem cells remain alive for 4 or 5 months. And when I say a stem cell procedure, I mean stem cell and PRP. The type of stem cells we do here are from your fat, only DNA matched stem cells. So to have a good, what area are you interested in?
It's my husband.
And what does he have? He has
Hand and shoulder.
hand and shoulder. Okay. So I use stem cells from fat in our protocols.
Got a lot of that.
Yeah, and we use your growth factors, which is from your blood. Hi, welcome.
Sorry.
Welcome. It's okay. We'll catch up. It's okay. We'll have time. It's a small group. Yeah. Yeah. Yeah.
That's just like Sarissa.
Yeah. Well, to have a good result or the best result with stem cells, you need to use stem cells from fat, DNA matched stem cells from your fat. We need to use your growth factors from your blood, and it needs to be fresh stem cells. Okay, stem cells that are fresh work much better. There's something called cytokines, which after a few hours they disappear. So you need that. Yeah.
So there's something good about having fat.
Yeah. Finally, something good about fat, right? The fat that's so hated has a purpose, right? And then people say, well, just can't you take more, you know? And I say, can't I just donate to the whole clinic, you know? But because it's DNA match, it's only good for you, right? But this is a bank of valuable cells, okay? And then people say, well, okay, if I got the stem cells in the fat, how come they can't go to, what are the areas that you have? Shoulder, hand. Why can't the fat just kind of, or your knee, can't you just push the fat down to the knee, and can't it just work that way? You know, it's stuck. It's stuck in the fat. Okay. So what am I doing? I'm a regenerative doctor. It's my expertise to find the spots that are critical. We need to put the stem cells within a dime of where the problem is, and I actually have to palpate the joint to find where the spots are, because micro tears in the ligamentous tissues don't show up on MRI or ultrasound, right? So that's the problem. So palpation, interrogation. I wrote a book on stem cell orthopedics. There's a book over here. Hold it up.
Yes.
Stand up and hold the book. There you go. This is Lorraine. This is the book. This is the book. There's the book. There's the book.
Our daughter had it done on her shoulder.
Did she? Okay.
And it worked.
Okay, great. So that's great. Yeah, if you ask me nicely after, I'll give you a copy. I'll sign it for you. I don't want to sell it, you know. It seems kind of, you know, I don't sell books. But I'll be happy to give you a book. If somebody really wants one and you promise you're going to read it, I'll give it to you. Okay. So.
Dr. Mark, what's the volume that you put in, say, is it so many cc's or?
So we're going to take about 60 to 80 cc's of fat, which is about 60 to 80 million stem cells. And we're roughly going to have about 10 or 15 cc's that we're going to inject.
Okay.
So not only do we want to inject it in the joint, but it has to be injected around the joint. Because the goal is not just to, you know, like a knee, for example, and this applies to almost every joint in the body. It's not this, it's this. It's the instability of the joint that's the problem. That's the same thing for the shoulder. It's the same thing for the fingers. It's the same thing for the... What part of the hand bothers you?
Well, I guess this one's clicking.
Okay, let me just
This
see.
one's
So clicking means instability, right? It's subluxing. Let me just take a little look here. Tender? No?
Well, a little bit.
Little, not too bad, not too bad. No, not too bad. Not too bad. And what other joint?
This one.
Hurt? Tender? Not really?
No.
No?
It's just gnarled.
Just gnarled, and so it doesn't,
It hurts, yeah.
that hurts a little bit?
on the thing.
Okay, okay. I'm just looking to see,
Yeah.
you know, what area. And this shoulder is the problem?
Yes.
Let me just take a quick look here. Tender here? Not really.
No.
You're tough, man.
Yeah.
Tender here?
Yeah.
Okay, good. Yeah. Yeah. Yeah, you're alive. He's a tough case, you know. Some people really, you know, have a much more powerful, you know, response. Which knee is it that bothers you? Let me just take a quick look. Yeah. Ben, no, it's okay. Sit. Yeah. Let me just have a look. Tender. Mm-hmm. Yes.
Yes,
Just. Yeah.
yes.
Okay.
Especially on the
Okay.
flowers.
Okay. Yeah, this is palpation interrogation. I'm testing the structures to find and prioritize where the stem cells need to go to work the best.
And do you do it under fluoroscopy?
The micro tears don't show, unfortunately. It has
So
to be
you do it
palpation.
under-
Yes,
okay.
palpation guidance.
Okay.
Okay. Digital guidance, you know, digital being the finger. Yeah, this is a kind of, you know, when you understand regenerative orthopedics, this is a lost art. You know, no orthopedic surgeon palpates. Looking at the ligaments and tendons that support the joint. They're interested in the MRI, you know. So, you know, this is a totally different approach, right? But our goal is, once you understand regenerative orthopedics, you may come to the conclusion that, hey, this should be primary care orthopedics, what you do. Okay. God forbid you can't fix it, then, you know, I can always have surgery, if needed. Yeah. You didn't catch the dates. These are the dates of the stem cells.
Dr. Mark, why doesn't insurance pay for it?
Yeah,
Is it
you're
just
getting into the politics of.
progression
Well, first of all, nothing is really standardized in the stem cell world. Look, I have been a regenerative doctor for over 20 years. I've injected, it's been my practice it's been my specialty for the last 22 years, 23 years, okay? So that's all I do, right, is regenerative injections. And the type of stem cells I use, again, there's a lot of discussion out there, oh, we should use umbilical stem cells, and I have found that DNA matched stem cells from your own fat work far better. Okay, if umbilical worked, I would use it, right? Except I don't really like the idea of injecting foreign DNA in people, But if it worked, I would use it, right? So these are protocols so again, it's not really standardized. So that's a problem right away. There's no real official specialization in regenerative orthopedics, right? You have some doctors that do it. I'm probably there's maybe a couple in Florida, 2 or 3 good regenerative doctors in Florida, and that's it. It's not a lot, it's not a lot of people.
So are there non-doctors?
I beg your pardon?
Are there non-doctors injecting stem cells?
Well, yeah. So there's a lot of people who talk the talk, okay? Nothing against chiropractics, but some of them hire ER doctors and they say, oh, okay, let's just, you're going to do stem cells, right? We're going to talk, but they're not regenerative experts, right? So there are people who are non-regenerative doctors who do it. Like surgeons or ER doctors or, as you understand regenerative orthopedics, this is a specialty unto itself, right? So if you're going to do stem cells, you need to do it right. That's the only thing I would say. Yeah. You might have missed this. Did you hear? It's
That's the cost part.
Yeah, $7,000 for one joint. Like a shoulder is $7,000 or a knee is $7,000. A hand would be half price. Depends how many joints involved. But
Ooh, that's a lot more than I thought.
yeah,
And
well, that's it. You see, but
one
again,
treatment.
that's for
treatment you
one.
do it.
It's a one-day thing. You're going to come and do it. And let's say we did your shoulder and you came and you said, yeah, it's 50% better, 60% better. 6 or 8 weeks after, we may decide to do a PRP booster because the stem cells remain alive for 4 or 5 months. And you see a lot of people are talking stem cells and, oh, just 4,000 or 5,000, sure, coming. But that's umbilical stem cells, right? That's not DNA matched stem cells. So you need to compare, apples to apples and understand why. And the only thing I would say is, if you're going to do it right, So.
Could you refresh my
Yes.
memory on PRP?
Yeah. So PRP is the growth factors from your blood. So it's included in your stem cells. So when you come for a stem cell procedure, we get stem cells from your fat, and we take PRP from your blood, platelet-rich plasma. Okay, and we mix the two. Yeah. So PRP is the growth factors,
Can you
and
use that by itself?
you can. It's not as powerful. So stem cell and PRP is 10 times more powerful than just PRP alone. And if you ask me, well, doctor, why are you a stem cell doctor? I'll say, because I have only one chance to make a first impression, right? No one comes here for fun. If you do, well, that's another type of problem, right? Yeah, I mean, look, it's not pleasant, and it hurts a little when you're doing it, and some areas hurt a little more, but an hour later it feels fine, and you might be a little sore where we took the fat the next day and so on, but it passes quickly. And it's the only option to serious joint degeneration.
So you're saying this would replace having a joint replaced?
That's the goal. So instead of rotator cuff surgery or joint replacement, our goal is to fix the joint so you never need that. Hands is pretty. Your hand isn't that bad, is it?
Nah. I cannot decide which is worse, my shoulder or my hand. But
Okay, okay.
I think a little cortisone shot might just do it.
Yeah, well, you want to avoid that because cortisone accelerates degeneration. You want to try and, a regenerative injection is a much better idea than a cortisone shot. Cortisone makes.
I was told I needed shoulder replacement.
Okay,
Actually,
well, we're gonna.
not yet.
We could try and turn that around, okay? Because so after our talk here, I'm going to give you a little tour, and then you're all welcome to come for a personal consultation where I can actually examine you more formally and tell you, okay, this is if you decide to do this, this would be the deal. There's no obligation, but you can come and say, okay, if I did it, what would that look like, right? I'm just trying to give you an idea of roughly. I don't think your hand is that bad, so for you it'd probably be $9,000 for hand and yeah, okay.
One other question.
Yes,
What kind of difficulty does taking blood thinner have?
you need to stop like 5 days ahead because I don't want you bleeding when we take your fat.
5
So you just need to ask your doctor, say, hey, I'm going off this, I'm going to have a little stem cell procedure,
Okay.
just so you don't bleed when we take the fat. Yeah, pretty straightforward, yeah.
Take the fat with a cannula or
Yes,
something?
yeah. So it's like you do a little keyhole incision, you take a little fat. I have a liposculpting surgeon that takes the fat. I'm the injector. You don't want me taking your fat. I can do it, but no, I'd rather have an expert
So
take
you
the
do
fat.
that through an incision?
A keyhole incision, yeah. Yeah, it's all done under local. So you come in, we take your blood, we take your fat, you relax for a couple hours, and then we inject the stem cells immediately. They need to be fresh, need to be from fat, need to have PRP, and needs to be fresh. And you need to have a doctor who knows where to put it.
So the couple hours is while they get mixed
We prepare the stem. Well, we got to get the stem cells out of the fat. They're stuck in there.
So like a centrifuge or something?
Yeah, well, that and natural enzymes.
Excuse me, you said
Yes.
something about this lasts like six months, I mean the stem cell thing. Do you have to have it done again then?
No. I'm just saying, like, let's say you'd come and do a stem cell procedure, and then you say, it's like 60% better, after 6 or 8 weeks. I may decide to do a PRP booster, okay, because the stem cells are still alive, they're still in there, okay, and that's generally depends how many areas involved, but somewhere in the area of $1,000 to $1,500 for the booster. It's not the stem cell procedure again, it's just the PRP booster.
Okay,
So
when we talk about long-term success,
Yeah.
80 to 85%.
Yes.
That means that if I have it done,
Yes.
my chances are that my pain will be gone by 15% of it, or to 20% of it, or is it number
80
of patients?
80% chance you're going to have 80% success. I mean, I'm just trying to give you a rough idea, okay?
So if you're a betting person, you say 80 to 85% that you're going to feel better afterwards.
Right. I mean, the goal is quality of life, and we're trying to give you a way to improve the joint that you don't have to have surgery. Look, not to say anything bad about surgery, but it's a risk, right?
And the growth that you're promoting is in the ligaments?
It's in the ligaments and in the joint.
In the joint?
Oh yes,
Where the cartilage used to be?
yes. I'm not going to say we regrow cartilage because all kinds of guys will argue about that.
Okay.
But let's talk about stability. We need to change the paradigm. It isn't just that your cartilage is worn out. The joint is loose, okay? And this is bad, and this hurts.
Yeah.
So we need to tighten and strengthen that joint, okay? And it isn't just about the cartilage. It's about the stability of the joint. So we're changing the paradigm,
So it
okay?
actually helps those micro tears that you
Yeah.
referred to.
It tightens the ligaments.
Okay.
For your hand, I mean, your hand isn't too bad, but some people have like tendon transplants and ridiculous. We just need to tighten the joint. The joints are loose.
When you take the plasma, do you put the rest of the blood back in?
No, I'm not giving you plasma. No, we take blood,
Yeah.
we isolate the platelets,
Right.
and concentrate the platelets, and that's where the growth factors are.
Yeah. All right.
You know, we're not going to, like, you're not going to have...
Plasma in college for beer money. I
No.
thought that's what you're taking that out.
No. I'm taking your blood out, your whole blood out, and isolating the platelets, and we're going to discard the plasma. You want it
You're
back?
doing the opposite. Okay.
Yeah. No, it's not the plasma we're after. It's
okay. You're
the
doing the opposite.
it's the
Okay.
platelets that we're after.
Gotcha.
Okay. You know, some people use it for their skin and stuff, but you know, those are that's beside the point, right? No, we're not really. And in some cases, we inject the plasma also, plasma component in some areas. Sometimes that can be helpful. Okay, but it's not the main thing that we're after. Yeah, I'm going to say, you just ask Olga for a time, come in, I'll examine your back, and I'll tell you immediately if you're a good candidate. Where do you guys live?
Well, I'm full-time up in Cleveland.
Oh, you're just visiting?
Well, we're down here for a few months.
Oh, you're down for a few months. Okay. So, yeah. So I just need to examine your back, put you like on the table, and I need to look at the structures there to find what's going on, even though you've had surgery. You have metal in your back? Yeah. So I would not inject that area. Okay, I'm going to work, but I do need to check the pelvis because that could be a big deal. Okay. Hope for a simple answer. Okay. So what am I going to do? Well, these are the ligaments here. Like in the body, I mean, they're showing discrete ligaments. It's actually sheets of ligaments, you know, kind of holds you together. It's what you call the myofascia. This is just a depiction, right? I mean, you've got ligaments on the lateral side, on the medial side. The whole thing is encased in ligaments, and they're very strong. It's what holds things together. But the problem is, over time, it can degenerate and loosen, and then when you're walking, without you realizing, it's subluxing a little bit, and when it subluxes, it's pulling on the micro tears of the attachments, and that's a big deal. That causes a lot of pain. So number one, it's important that we fix, you know, I see you got shoes. I don't know, Boris is looking at your shoes. I don't know if he likes them or not, okay. but yeah, they're not bad. So, you know, you want to have shoes that when you're hitting the ground, things aren't like, you know, moving around too much, right? And then number two, then we have to look at, hey, what can we do to make this joint stronger and more stable? So those are the dates of the upcoming stem cell procedures. So we still have some space in March, and actually all the dates are available as of now. Okay, and then so what I'm going to say is just if you're interested, just you know, let Olga know. Please come in. Happy to see you, examine you, and I'll tell you right away. Hey, yeah, this is a good idea, and these are the dates we could do it, and this is what will be involved. Okay.
What do orthopedic surgeons think about this?
They think it's, you know, they just don't think we're there yet. So, and
Exactly
then,
what I heard.
yeah, well,
It's not
and
gonna
that,
be in your lifetime or my lifetime is what I heard when I asked. my
yeah,
orthopedic
okay.
surgeon about
So
it.
that kind of is, the next question should be, doctor, how many stem cells have you done? And they're going to say none, because they don't know anything about it, right? They're not educated. And then if you ask me, well, why don't they know anything about it? It's kind of an important field. I say, well, because this is not the way medicine has evolved. Medicine is big business, you know. Medicine's big business. And the business is based on, you know, medical devices and pharmaceuticals and surgery. That's what the system is based on. So how does the medical system get into, you're going to come to my office, I'm going to take a little fat, I'm going to take a little blood, and I'm going to fix it naturally. How does the medical system get into that, right? How can they be the middleman to take a piece of that, right? And yeah, you may say, well, oh, how come it's $7,000? Well, you know, a knee replacement is $40,000 or $50,000, assuming it's uncomplicated, right? So it's just, you know, you just have to understand that this just hasn't, eventually insurance companies may decide, you know, Dr. Walter, we heard you got good results. You know, we've got 100 people that are slated for knee replacement. We're going to offer them the option to come and see you. And then we're going to study the results, right? The problem is there's not enough of me around, you know, to do that on a bigger scale.
So I wondered, so have people written papers about this?
Oh,
kind of
many,
thing? So it's
many.
all out there?
Look, you internationally, Israel and India and many other countries are, you know, into stem cell
I wondered.
research. Look, stem cell, if medicine doesn't know how to do it, stem cells may know how to do it. Okay? Stem cells are the way you were built to start with. Right? So we're just trying to isolate those healing elements and concentrate it and put it in the right spot. So listen, stem cells, I will say that not only stem cells can fix a majority of what we're talking about here, but if it works, it's a much more elegant solution, maybe a far superior solution, and far less risk. You know, for your hand, I mean, you know, you could take painkillers. I mean, you go see a plastic surgeon, he'll talk about a tendon transplant, and, you know, not really a reasonable way to fix it.
I'm an operating room nurse, so I've
You're what?
an operating room nurse
Oh, cool.
for 30 years.
Oh,
So
cool.
I've seen and assisted on plenty of total joints, so
Cool.
I'm very aware
Of what's
how
involved.
brutal it is.
It is. Look, I'm a woodworker, okay, and sometimes I look at it and say, "Whew, that's pretty rough carpentry you going there," you know. Listen, I'll tell you something. I am amazed how well people do, considering how invasive the procedure is. I mean, that is a testament to modern medicine, how well people do, right?
Yeah, I think it's a physical therapy afterwards where you hear them moaning and groaning.
Yeah, well, all right. So just a couple offices and autoclave and so on, storage areas. And this is our lab where we have various centrifuges and a hood, you know, to keep things sterile and so on. So one of the important things, if you decide to get a stem cell procedure, is you want to know, well, okay, no one's running down the street with my fat, right? Mm-hmm. You want to know that it stays here, right? Because if you go to Mexico and have a stem cell procedure, well, you know, stuff happens down there, right? So this is our little OR where we take the fat and we take the blood in the phlebotomy room down there, and we take your fat here. It's all done under local, okay? Just a little numbing here. Thank you. I have an OR nurse who's just going to like kick it around and make sure everything's proper. Hey, what kind of sterile procedure do you do here? And then this here is a lounge. So after you have the fat taken and the blood taken, you relax here in the lounge while we prepare the stem cells. It's very important you understand stem cells need to be fresh for them to work the best, right? Because there's some cytokines around the stem cells which help them work, right? So our goal is to give you the highest quality stem cell procedure possible. And I've been in the field for 20 years. So the other thing is you use the best stem cells possible, the best PRP possible, and then you need a regenerative doctor who knows where to put it. And you're right, it has to be like within a dime, okay? And unfortunately, MRI is of no use for that. Mm-hmm. And, you know, ultrasound is of limited use. I haven't trained in ultrasound, but we generally don't use it. It's palpation, you know, we gotta find where's the worst spots, and we need to put the stem cells. We need to prioritize those spots.
You find that by how much pain it costs.
Yeah, exactly, yeah. So, you know, people say, oh my God, you have like steel fingers, doctor. I said, well, no, my 30 pounds of pressure shouldn't hurt. Okay, if my 30 pounds pressure hurts on a certain structure, it's way weak, okay? The structure should be able to sustain, you know, how much you weigh?
200.
200 pounds, right? It has to sustain that, right? So this is like a lost art. This art of palpation interrogation is like a lost art, but very, very important when it comes to rebuilding ligaments and tendons. So I'm really, in essence, I'm a ligament and tendon specialist, okay? And orthopedic surgeons don't know anything about this. They don't get that. They understand if ligament or tendon is totally avulsed, but they don't get the micro tears at the attachments. They don't understand the instability of joints. Very good. So thanks for coming. And just let Olga know, and we're happy to see you. And you're welcome. You should. And for you, are you going to come? You think about it. Gee, what kind of deal do you need, man? Up to you. Well, what I need to do is examine your back. Okay, that's really important. You really should come, and I examine your back, because I'm about the only guy who's going to tell you what I may tell you. Okay, so it's totally worth it. Up to you. Okay, not to force you. Okay, all right, very good. And thanks for coming.
Yeah, thanks.
Thank you.
Thank you. I'll see you Friday.
Hey, look forward to seeing you. Okay.